Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy-to-understand concepts. Did you know that a single missing enzyme can make dietary protein dangerous? That's exactly what happens in phenylketonuria, or PKU. A rare inherited disorder where the body can't break down phenylalanine, an amino acid found in protein-rich foods. When phenylalanine builds up to toxic levels, it interferes with brain development and function. If left untreated, this can lead to intellectual disability, developmental delays, memory loss, and seizures, among other serious neurological complications. PKU often goes unnoticed at birth, but the damage from elevated phenylalanine can build over time. And here's the critical part. If high phenylalanine levels aren't controlled early, the resulting brain damage is irreversible. Thankfully, newborn screening usually detects PKU shortly after birth, and treatment begins immediately. The goal is to keep blood phenylalanine levels under 360 micromole per liter. In classic PKU, this means lifelong dietary therapy, limiting phenylalanine intake while ensuring adequate tyrosine. This approach is generally effective at preventing severe cognitive complications. But there's a trade-off. Restrictive diets can lead to micronutrient deficiencies, particularly in selenium, copper, magnesium, and zinc. Managing PKU is no easy task. Dietary adherence usually drops during adolescence and adulthood. That's why pharmacologic options are a welcome addition. One option is Sepiapterin dihydrochloride, a synthetic form of BH4, a natural cofactor that helps PAH enzyme break down phenylalanine. In Europe, pegvaliase, a PEG-ylated phenylalanine ammonia lyase, is also approved for use in patients aged 16 years and older. This enzyme breaks down phenylalanine directly. But access to these medications isn't universal. But now, a new promising treatment is on the scene, Sepiapterin. In July 2025, the U.S. Food and Drug Administration approved Sepiapterin, marketed as Sephience, for adults and children as young as 1 month old with phenylketonuria. This approval opens the door to greater dietary flexibility, allowing patients to meet or even exceed recommended daily protein intake without compromising metabolic control. So how does Sepiapterin work? And how does it help in PKU or PAH deficiency? Let's break it down. Phenylalanine hydroxylase, or PAH, is an essential enzyme that helps maintain normal levels of phenylalanine, an amino acid found in protein-rich foods. Under normal conditions, PAH breaks down phenylalanine into tyrosine, a precursor for important molecules like dopamine, norepinephrine, and melanin. To function properly, PAH requires a cofactor called tetrahydrobiopterin, or BH4. BH4 acts like a molecular helper, enabling PAH to carry out the conversion of phenylalanine to tyrosine efficiently. Without enough BH4, even a healthy PAH enzyme can't do its job. In phenylketonuria, or PKU, this system breaks down. Most commonly, PKU is caused by mutations in the PAH gene that lead to a deficiency or dysfunction of the PAH enzyme. As a result, phenylalanine is not properly broken down and begins to accumulate in the blood and brain. High levels of phenylalanine are toxic to the nervous system. They disrupt white matter development and impair neurotransmitter synthesis, leading to cognitive impairment and other neurological problems if left untreated. However, not all cases of PKU are due to a complete lack of the PAH enzyme. In some individuals, the problem lies with insufficient levels of BH4. This form of the condition is often referred to as BH4-responsive PKU. Because increasing BH4 levels can enhance residual PAH activity and improve phenylalanine breakdown. This is where Sepiapterin offers a potential therapeutic benefit. Sepiapterin is a naturally occurring precursor to BH4. Think of it as the raw material. Once inside the body, it is converted into BH4 by the enzyme sepiapterin reductase. The newly produced BH4 can then serve as a cofactor for PAH, boosting its activity and allowing it to convert phenylalanine into tyrosine. This can help lower blood phenylalanine levels, particularly in patients who still have some residual PAH activity or are responsive to BH4 supplementation. Interestingly, sepiapterin may also have an additional BH4 independent effect. It acts as a pharmacological chaperone, a small molecule that helps stabilize or correct the folding of proteins. In the case of PKU, many patients have mutations that cause the PAH enzyme to misfold, making it unstable or non-functional. Sepiapterin's chaperone effect helps these misfolded PAH enzymes fold correctly and stay active, even in the absence of optimal BH4 levels. This independent pharmacological chaperone effect gives sepiapterin a dual mechanism of action, boosting BH4 production and stabilizing PAH itself. Together, these mechanisms help reduce toxic phenylalanine levels more effectively and expand the potential benefit of treatment to a broader range of PKU patients, including those with certain PAH mutations. The FDA's approval of sepiapterin was supported by compelling evidence from the Phase 3 APHENITY trial. In this trial, sepiapterin was used alongside phenylalanine-restricted diet, with the aim of diet liberalization, helping patients consume more natural protein. According to the developer's press release, key findings included the following. Over 97% of participants were able to liberalize their diet while on sepiapterin. This means they could consume a wider variety of foods without risking elevated phenylalanine levels. On average, participants more than doubled their natural protein intake, with a 126% increase compared to their baseline levels. Additionally, 66% of participants in the phenylalanine tolerance sub-study were able to meet or exceed the age-adjusted recommended daily protein intake for individuals without PKU, all while maintaining stable phenylalanine levels. Genetic analysis revealed that over 70% of participants had genotypes consistent with classical PKU, providing useful insights into who might benefit most from sepiapterin therapy. With this approval, sepiapterin represents a new era of phenylketonuria management. One focused not just on disease control, but also on quality of life and nutritional freedom. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.